The facts are heart-stopping. Every 22 minutes, a woman in Canada dies of heart disease. What's even more shocking, most of them don't have to.
We have one of the best healthcare systems in the world, and we're not serving women to be having a statistic like that. Many of these are avoidable deaths, and we have to do better.
When it comes to heart health, women are practically invisible, underdiagnosed, undertreated, and often unaware. 24,000 Canadian women die of heart disease every year.
That's nearly 5 times more deadly than breast cancer. So why is heart disease killing so many women? We're going to speak to leading experts in women's heart health to find out.
Dr. Paula Harvey is a cardiologist and head of the Department of Medicine at Women's College Hospital in Toronto.
When we really started to improve the outcomes from cardiovascular disease in the 60s, all of the attention was on men. And there was no attention at all to the fact that women also have cardiovascular disease. Really, it's only been in the last few decades we're starting to understand that you're missing half of the world's population.
For women, heart disease can be like a ticking time bomb. Diabetes and certain ethnic backgrounds increase the risk for some. But over a lifetime, heart-protecting hormones fluctuate and decline in all women, especially as they enter menopause. Estrogen levels drop and the risk of heart disease goes up. And that dangerous transition starts in a woman's 40s.
Women are still not being educated, they're not being counseled, they don't understand the impact of our changing biology with age that puts them at cardiovascular risk.
Do you see patients who are surprised, who say, I've been healthy all my life, why did this happen?
All the time. All the time.
I was still 2 months after my event reeling from that shock.
Risa Mallory had a heart attack 4 years ago when she was 61 years old.
I had this life-threatening event, and so it shook me to the core.
At a support group in Ottawa, survivors like Mallory deal with the aftershocks of a heart disease diagnosis.
I didn't talk about it a lot until I got stronger.
Mallory says her heart attack started with a discomfort in her chest that came and went for days.
The 4th day I experienced chest pain, it had changed. It was much more severe. I was feeling nauseous, and I had this sense of fight or flight. Like I felt like I had to go somewhere. I don't know where or why, but I remember sitting in the car rocking and saying, we gotta go, we gotta go, we gotta go. Next thing I do remember the nurse yelling at me saying, stay awake, Risa, don't fall asleep, keep breathing, don't fall asleep.
Even more scary, Mallory has heart disease in her family. She's aware of her own risk, but she's still almost missed the signs.
I even asked my cardiologist, how are my organs not damaged? How do I not have brain damage? How much time did I have left to live? And the answer to the latter was minutes, and the answer to the former was you were just lucky.
The point is, unlike what you see on TV, women don't typically have dramatic heart attacks. Their symptoms can be different from men's and may be attributed to stress and busy lives.
For example, take a look at this. When a heart attack is looming, women may experience unusual fatigue, indigestion, anxiety, trouble sleeping. And even during a heart attack, the symptoms can be subtle too. Women often feel chest discomfort, shortness of breath, pain in their neck, jaw, or back. Women can miss the warning signs, and often doctors do too.
What it tells us is that there is still a lot of inequalities and bias at the community level and at the healthcare provider level.
Dr. Thais Coutinho is a cardiologist and chair of the Canadian Women's Heart Health Centre at the University of Ottawa Heart Institute. Coutinho says many women are in the dark, in large part because much of the medical community still is too.
That assumptions that women may be small men, if it's applicable to men, it may be applicable to women, still permeates through the cardiovascular research community. And I do a lot of sex and gender-based research or women-specific cardiovascular research, and it's amazing the differences that you find if you look.
Morning, doctor.
But traditionally, heart research only focused on men.
You see this model of the human heart.
Even though women's hearts and arteries are smaller and plaque builds in different ways. It's why standard diagnostic tests like angiograms and stress tests are still often not sensitive enough to detect heart disease in women.
There is still cardiovascular research being done that is excluding women. It's very critical.
Cochino says that has to change.
All of the gaps that we know exist, awareness, diagnosis, treatment, care, rehabilitation, education, everything, it starts with knowledge.
For her not to listen to my symptoms was really concerning.
Samia Jana was 48 years old when her doctor dismissed her concerns about her shortness of breath. She was prescribed anti-anxiety medication and told to take time off work.
I went back to her after a month. I said the symptoms are still there. So she increased the medication and another time, 1 month off from work. And then I went again, and then another 3rd month off from work and still on anxiety medication. At that time I said, no, I know it's not anxiety. I know myself, just there's something wrong with my heart.
Blood tests didn't flag anything, but Jana pushed for an ultrasound that revealed her heart was enlarged. She ended up having open heart surgery twice.
It took time for me to let it go, to let the anger go.
The last 4 years haven't been easy, but what she learned at a cardiac rehab program in Ottawa is helping her get stronger mentally too.
Being between 4 walls would have really increased the depression and the anger and the anxiety and the loneliness. So I joined the cardio rehab. If it wasn't for them, I would have been in a very dark place.
Okay, so we're going to start with our stretching.
Cardiac rehabilitation can be crucial for physical and emotional recovery, but women are up to 50% less likely than men to attend cardiac rehab programs, often because they don't get referred to one.
You may push up.
It helps explain why women who have a heart attack are more likely to die or suffer a second heart attack compared to men. So what now? Knowing all that we know and still don't know, what can women do to protect themselves while the medical system catches up?
The good news is you can dramatically reduce some major risk factors by managing high blood pressure, not smoking, and sticking to a healthy weight. Another big one, experts say, advocate for yourself. Urge your doctor to check your heart.
That, I think, is key. We need to be empowered. Knowledge is power. Advocacy is power. It's amazing to be a woman. We just need to be aware of what happens across our lifespan, be ahead of the game.
It all comes back to saving lives, because most heart attacks don't have to happen. And for women especially, prevention starts when the threat to them becomes more visible.
So, Ioanna, we know the risk seems to increase as women age, but there is a concern right now about younger women.
That's right, Ian. Experts are noticing an alarming trend among women in their 40s. Many women in that age group are presenting at their doctor's offices with high blood pressure, obesity, diabetes, and many are smoking. All of these are risk factors for heart disease. Now, here's where the double threat comes in. As we mentioned in our report, levels of the heart-protecting hormone estrogen start dropping in women in that age group. So they're already vulnerable. And research is already pointing to a higher rate of heart attacks among younger women. So the threat seems to be playing out. All to say that experts are worried, and they really want to underscore the point that the majority of heart attacks can be prevented by sticking to a healthy lifestyle and getting your heart checked regularly.
Thanks, Ioanna.